I'm with Dr. Don Sin, a respirologist at St. Paul's Hospital. Dr. Sin, what is chronic obstructive pulmonary disease, or COPD, and how much of an impact is it having on the healthcare system right now?
Well, in the past, COPD used to be called emphysema, or chronic bronchitis, or asthmatic bronchitis, or even smoker's lung. About 20 years ago, we grouped all of those terms together under the umbrella of COPD, or chronic obstructive pulmonary disease. It's a lung condition where the breathing tubes get progressively narrowed to the point that patients have trouble breathing, especially when they walk or exercise. And they also develop a cough and phlegm production. The shortness of breath can be so severe that it leads them to emergency rooms and hospitals, and in extreme cases, even to death. COPD is the leading cause of hospitalization in British Columbia and throughout Canada. COPD costs the healthcare system about $20 billion per year across Canada and about $2 billion in BC. So it's a big problem, it's a big burden on society.
Can you explain the simple blood test that you're developing and how it will improve the lives of patients currently suffering from and at risk of developing COPD?
The problem right now for physicians, for doctors, is that there's no way of diagnosing acute lung attacks for patients of COPD until it's very late in the game, when patients have to be in hospital or have to be treated with very strong medications. Most patients present to their family physicians or specialists complaining of shortness of breath, but doctors can't figure out whether that's because it's a lung attack, or that they're simply getting old, or their disease is just progressing. A simple blood test for diagnosing and prognosing COPD lung attacks would help doctors to give the right medications, and most importantly at the right time, at the earliest time possible, for patients with COPD who are having lung attacks before they get into hospital.
Great. Thank you very much, Dr. Sin.
Okay, thank you.
Sorry.